Good afternoon, everyone, and welcome to the third webinar in this series from Ofcom on our Online Safety, Protection of Children Consultation. We're really grateful to have so many guests register with us for this third session. The first two have focused on providing an overview of the consultation, the Child Access Assessment duty and our draft guidance on that duty. Secondly, on our assessment of the risks that children face online. And third, and as part of that session, we also looked at the types of content that are harmful to children prescribed by the bill. And in this third session, we're really focusing on the safety duties and the measures or the draft measures that we expect platforms to take should they use our codes of practice in particular. We have a Q&A session after about 30 or 40 minutes of presenting from our team. If you'd like to submit a question, please do. The Q&A tab is at the top of your screen next to the chat. If you submit that or like other questions with the thumbs up, we can know which are most popular. We'll try and get through as many as we can, and if we miss any, we can mop those up after the session today. We'll be posting a video of the presentation section today that we will share with all those who've registered. The videos from the first two webinars will also be available, so you can follow up on those and see the slides. The final thing to say before we get started is that we are now in a pre-election period, which means there are certain guidelines by which we'll be abiding today. So leading up to the general election on the 4th of July, we're not going to take any questions or get into discussion points that relate to party politics or anything that could be sensitive around the Westminster elections. We're going to focus on the material that we have already published and try and provide any clarification or explanation of that material. That's not a hard and fast rule for Ofcom, but as an independent statutory body, we are going to follow those restrictions. I hope that makes sense, and I'm sure that there's still plenty to talk about without getting into any political issues. We're looking forward to your questions. A flag, which I will repeat at the end, is that we'd love your feedback after this webinar. If there are things that we could improve or things that were particularly useful, please do let us know, and it helps us prepare for any more events like this that we might run as we roll out our online safety programme. So I'll pass over to my colleague Almudena, and now we're going to work through this agenda, which is really focused on a quick word on our approach, our overall approach and methodology for developing the draft codes of practice, and then we'll get into the measures themselves. So I'll stop speaking there and hand over to Almudena. Thank you.
Thank you, Ali. Can we go to the next slide, please? I'm really going to try to spend as little time as possible talking about the wider context for our consultation, because looking at the list of participants today, the vast majority of you have attended either or both of the webinars before. So for wider context, I encourage you to look at the videos of those two first webinars. But just very quickly to put in the context our Protection of Children Consultation of the 8th of May. In this slide, that would be what appears at the top of the stack. And this consultation now is open and is what is the focus of our discussion today, and has been the part of the discussion of the two previous webinars. But this doesn't sit in isolation. So just when we talk about protection of children more generally, that builds upon our proposals on illegal harms and the codes of practice there. And in relation to children, that would cover protections from all types of harm, including fraud and terrorism, but also very much in particular protections from child sexual abuse and exploitation and grooming. And it also, the consultation that we currently have open builds on the Part 5 guidance consultation that we published in December, and we are currently analysing the responses to that as we are for the illegal harms codes of practice. So this is the wider context. When we published the Protection of Children consultation in May, the sequencing of that consultation meant that we hadn't had the time to review and consider the responses to the other 2 consultations on illegal farms and Part 5 guidance. What we have published is not meant to preclude in any way our responses and our final statements on illegal farms and the Part 5 guidance, but just to flag that we will be taking that feedback on the whole as we move our statements on all those regulatory products. On the whole, all these regulatory products are there designed to make life safer for children in the UK online. So next slide, please. And in terms of the conversation today and how it fits with the other aspects of the conversation that Ali mentioned, this is very much about the 4-step process that companies need to follow. First, they need to assess whether children are likely to access the service, and if so, they are in scope of our children's duties, and they must complete a risk assessment, which was the focus of the webinar last Monday, I meant. Once they have established the risk to their service, they have to implement safety measures. And for that, they can look at the proposed measures that we have in our codes to help them mitigate and address the risks that they have identified. And before, like that green box is going to be the focus of the discussion today, and we will go into detail on the proposals that we have published. But before we go into that detail, I also want to flag that those are a proposed way that services can follow to meet their duties and to mitigate their risk. But services are free also to look at alternative ways that might help them address the risk that they have identified. And they will be best placed, knowing their own service and knowing their risk, to know how best to address the risk. Those measures, as I say, will help mitigate the risk, and my colleagues Jess and Martha will discuss what we are proposing. We are also very much thinking about them in terms of proportionality, and we'll also discuss what does proportionality means in this context and how we interpret that. And this, just flag again, this is an iterative process. Risks are not static. Services change, user bases change. So services have a duty to keep assessing that risk that their services might pose, and the extent to which the mitigations that they are putting in place are helping to address the risk that they have identified. Next, I think with that, I'm not going to cover the requirements of the Act. I think people in this call should already be familiar with that. We can go back to that in the Q&A. So I think that I'm now passing on to Martha. Thank you.
Thanks, Almudena. So what we're going to start with today is just talk to you about the approach that we took towards developing the child safety codes. If we can move on to the next slide, I think we've got a little bit more detail. So there are kind of 6 kind of pillars that we have towards identifying the types of measures that we wanted to put in place for the codes of practice. This is all in accordance with our statutory duties, public law, and also a range of other considerations. So obviously our proposals are necessarily rooted in the Online Safety Act, and this is specifically the child safety duties, which, as you will kind of be aware, is around protecting children from primary priority content, so cyberbullying, violence, that kind of content, as well as preventing children from accessing suicide, self-harm, and eating disorder content and pornography. So that's the kind of basis on which we kind of developed these codes, was thinking about that and kind of like what we could do to kind of prevent and protect children from that kind of content. The other pillar was around our evidence base and making sure that our proposals were rooted in sound evidence, and making sure, again, you will have seen through the kind of the webinar that we did earlier on in the week around our kind of our risk assessments and the kind of evidence base there, and our proposals are based off of the kind of evidence that we had and the harms that we identified within the risk assessments. We've also conducted a huge program of kind of listening to stakeholders, particularly listening to children actually for these codes of practice. I mean, it won't surprise you that our approach is that children who are most affected by these proposals are the people that we should be talking to, so that we understand A, what they want, but also B, what is going to work for them and what they think is going to be kind of helpful for them. So we've talked to over 15,000 children as part of our work over the past 2 years as part of our beneficiaries. We're also doing a set of consultations with children over the kind of coming months to look at their response to the proposals and what they think about the mechanisms and the methods that we're proposing as well. Through our call for evidence, we've also been engaging with experts. So we've last year or the year before, and kind of it finished last year, we had a call for evidence with over 80 responses from a range of different organisations, including civil society, but also organisations and individuals, for instance, bereaved parents, and who are telling us about what they think that these proposals should be making and proposals that we should be making in this space. We're also continuing to talk to civil society and other groups about the proposals that we're making now, and this consultation is a really important part of the way that we're engaging with experts. Naturally, we also considered the impact on human rights, freedom of expression, privacy, but I think one of the things that we should also flag is that in the Act, it's also required that we have a higher regard for the safety of children within the Act. So that's part of the balancing process that we had to do within there. We also considered proportionality, and we're going to go on to talk a little bit more about what we mean by proportionality in the next slide. But I think one of the things that I should say about these approaches and these measures is that this forms part of what we call a safe harbour. And that means that, as Almudena said, if you take these steps, then you're considered to be compliant with the code, but there are also lots of other ways that you might choose to develop your safety features, and that could mean that you kind of do something slightly different as well. But if we move on to the next slide on proportionality, and hand over to James.
Thank you, Martha. So proportionality is a really important principle actually for everything that Ofcom does as a regulator, but I'll talk briefly about what it means for our work on protection of children specifically. So the Act itself has some specific requirements about us ensuring that our proposals are proportionate, and that's really important because we are aiming to deliver a high level of protection for children, which is one of the key objectives of the Act. But as far as possible, we would also like to ensure that children can still benefit from the many online services that are actually positive for children to use and that are not causing harm. And so in doing so, we have to recognise that there's actually a huge variety of different kinds of online services in scope of these duties. So clearly a one-size-fits-all approach is not going to be the right answer here. And that's why we set different measures, or we make different recommendations for different kinds of services. And in particular, we set higher expectations on those services that actually pose the most significant risks to children. So that's a key part of our overall approach. And in some cases, we also take into account other factors. So when we're deciding what we should recommend for different kinds of services, we also sometimes have regard to the size of a service, the purpose of a service, or other characteristics or functionalities that are relevant in terms of the kinds of risks they can give rise to. So my colleagues will talk a bit more on the next slide in terms of what the different measures are. So I'll just use a few examples to illustrate what this means from a proportionality perspective. So there is a set of measures which establish, if you like, a baseline that all services that are likely to be accessed by children should be doing. So these are kind of essential safety measures that we think all services should undertake. And these are things like having terms of service that are clear, having a reporting or complaints system that's easy to use, and having an accountable person that's been named as being accountable for compliance with the children's safety duties. But then there are several other measures that we don't recommend for all services, but only for those services that do pose significant risks of harm to children. And just to give one example of that, and often these are linked to functionalities as well. So for example, if a service has a group messaging functionality and the service has identified certain risks of harm to children, then one of the measures that we recommend is that they should make sure children are actually able to decline an invite to a group chat if that's not what they want to be doing. And finally, there are some measures where we actually set higher expectations for the largest services. And examples of this would be things like going further in terms of establishing additional governance processes, and also on our measures around recommender systems, going further in making sure that those recommender feeds are safe for children. But like I said, I'll stop there, and then I think my colleagues will take us through a bit more of the package of measures itself.
Thanks, James. So now we get into the kind of the meat of the discussion, I guess, which is around the kind of actual measures that we're proposing. If we go on to the next slide. So you will kind of see from this slide that we have some measures that, or some kind of chapters in the consultation that will follow the illegal harms kind of measures as well. So we have some kind of similar chapters which focus on reporting and complaints, on governance, on content moderation, and on terms of service. And then we also have some new chapters which focus that are kind of slightly different for the Protection of Children consultation. So this includes one on kind of safer algorithms, one on user support for children, and also on robust age assurance. Overall, we're covering 40 measures, so we're not going to be talking about them all today, but they do kind of fall into three main buckets of different types of measures. And I think this is covered in more detail in the next slide. So we have measures that are focusing on robust governance and accountability, on safer platform design choices, and also on providing children with information, tools, and support. So on robust governance and accountability, as mentioned earlier, all services will need to have a person appointed who's accountable for making sure that a service is adhering to the child safety duties. They'll also be the person that's responsible for the annual review of risk management, making sure that that's up to date. This is really about how do we, when kind of we say that services have to do these risk assessments, what's the process that they have to do and who is making sure that that is being done and that it's a kind of a living, breathing document. That's kind of what that person is intended to be for. There will also be some additional requirements on services, for instance, around a staff code of conduct, compliance training, internal monitoring and insurance, and also around kind of tackling new and increasing harm. And this is quite an important one because it's really about, again, how do we make sure that as services, you are kind of making sure that if the way that your service is changing in the way it's being used. A classic example of this would be during the pandemic. Services kind of were used in quite different ways, and that would change the kind of the risk profile of a service, for instance. So we have the robust governance and accountability measures, and that's kind of the first bucket. And then if we move on to the second bucket around safer platform design choices and the wheel in the middle, we have three kind of parts to that wheel. The first is around age assurance, and I think that Jess is going to talk to us a little bit more around age assurance.
Thanks, Martha. So the age assurance measures that we have proposed for this consultation fall broadly into three buckets. First of all, we have access controls. So this is for services whose primary purpose is the hosting or dissemination of primary priority content. So that is suicide, self-harm, and eating disorder content, or pornography, or priority content, and that includes things like violent content,
content that's abusive and hateful, but still doesn't meet the threshold of illegality. So services who specialise particularly in those subject matters will need to put in place highly effective age assurance at the point of entry to the service. The second bucket of age assurance measures is what we call content controls. So these relate to services, these are relevant for services who do not prohibit primary priority or priority content on their service. So if terms of service are drawn in such a way that this content is allowed, even if it is not the primary focus of the service, then a service would need to put in place highly effective age assurance in order to protect users from encountering priority content and prevent them from encountering primary priority content on their service. And then the third group of measures for age assurance are about relate to the measures that Mark was about to talk about recommender systems. So this will mean that services that have a recommender system will need to put in place highly effective age assurance in order to target the recommender systems measures at children. And I will talk briefly in a few minutes about how we are interpreting the definition of highly effective age assurance. But back to Martha for now.
Thanks, Jess. So yes, now we move on to our recommender systems proposals. We have three broad proposals. The first is around filtering out content from a recommender system that's primary priority content. So this is self-harm, suicide, and eating disorder content, as well as pornography. And this is about content that's likely to be harmful to children. So it's potentially casting the net a bit broader in terms of taking a precautionary approach. But the idea here is that you have to use forms of relevant available information to detect this content. So that might include automated content classifiers, reference to content that has been reported by a service, or other kind of ways that a service might detect harmful content, for instance, through hashtags or something like that. So services use the kind of relevant available information to detect that content, and then they have to filter it out. We also have a similar measure for priority content, so violent content, cyberbullying, dangerous stunts and challenges. That content has to be limited in the prominence of a service and limit it from the recommender feeds of children. For larger services, we're also recommending that services put in place a means through which children can express a negative sentiment privately about a piece of content. So this might be, for instance, if a child is recovering from an eating disorder, they may not want to see a lot of content about meal planning or fitness inspiration or something like that. So they can kind of make that kind of request to that service, and therefore they can kind of protect themselves from being exposed to content that they don't want. And one of the things that I should say about this kind of broad package of recommender systems is that we kind of are focusing on this as one of kind of the key areas, because we know that this is often an important way through which children are first exposed to harmful content. You may have heard this earlier on in the week, but we know that this is a really important way that children are exposed to harmful content for the first time. So that's one of the reasons why we are kind of focusing on recommender systems. We also have a set of content moderation policies that we are proposing. This is around kind of managing harmful content. And this, excuse me, this is has a set of measures. Some of them apply to all services. So for instance, having a content moderation policy in place, and then some are kind of more based on risk. So for instance, if you have volunteer moderators, you may have to kind of provide them with certain types of information. If you may also, for kind of larger or riskier services, you may also have to have a written set of content moderation policies to make sure that kind of your moderation is being done in a kind of consistent way, etc. And then we move on to the final bucket, which is around providing children with information, support and tools. And this is kind of one of the things that really came out through our kind of research that we did with children, is that actually they they want more control and feel more empowered online about the types of things that they can do when they kind of come across harmful content, or to manage the ways that they're coming across content. So, for instance, clear and accessible user reporting complaints systems. We know, for instance, a lot of children don't really report content. So this is about trying to make sure that it's easier for them to report harmful content, rather than kind of blocking or muting content or people that are kind of harmful. We also have a set of policies or a set of measures around accessible terms and conditions, terms of service. And this is around kind of making sure that children know and understand what it is that they can expect from a service and the types of things that they can or shouldn't be exposed to. And finally, we have some kind of user support tools and supportive information. So the user support tools are really around, for instance, the option to be decline being added to group chats, which we know is an important way through our research that children are often exposed to violent content or pornography, for instance. So giving children an option to kind of decline being added to group chats, as well as information at kind of important points in their user journey where they may have, for instance, reported that they've seen some harmful content. This would be a way for them to kind of be offered some support in the moment, so that rather than them having to actively go out and seek support, they're being offered it proactively at a point and at a time where they may be more likely to take up those kind of offers of support. I think if we move on now, we have a final slide, which is around our approach to highly effective age assurance, which I think Jess will talk through.
Thank you, Martha. So we have published, alongside our consultation, draft guidance on highly effective age assurance, which reflects the approach that we took in our draft guidance for Part 5 pornography providers, which has been consulted on separately, and for which we're still working through the outcomes of that consultation. So we may need to reflect adjust our approach to reflect any key findings that come through from that consultation as well. So those two processes are linked together. In the guidance, we set out that there are certain technological solutions that are capable of being highly effective age assurance solutions. However, it's not just about the technology, it's also about the way that it is implemented. And with that in mind, we have set out a principle-based criteria for ensuring that an age assurance process is overall a highly effective one. So the principles are set out in these boxes here. They are technical accuracy of the solution, the robustness of the solution, how it kind of holds up in a real environment with real people, not just a test environment, the reliability of that solution, including how easy it is to circumvent, and then the fairness of that solution and how it takes account of people with different needs, different features, different backgrounds, for example. We also recommend that providers consider the principles of accessibility, interoperability and transparency about how these processes work to ensure that the age assurance process is easy to use and doesn't unduly exclude adult users from content they are legally entitled to access. Just a word on this is that we know that the age assurance industry is developing really fast, and we are really pleased to see the work that's going on technical standards around accuracy. And we are really hopeful that the way that we have drawn our measures in our codes and the way that we have sort of set out this guidance gives enough flexibility for the age assurance industry and the users who need to, the services who need to deploy these solutions to come up with new and innovative ways of applying age assurance in order to protect children. That's all I was going to say on that. Thank you.
If you want to just move on to the next slide, please. yeah, I have said this in the previous two webinars as well, so I'll not dwell on the next couple of slides very long either, but we have tried to produce some accessible materials to help stakeholders navigate the complexity of the document. And we've got a summary of the consultation, and we also have a proposed codes at a glance, so please do look at them. But if you do need detail on the consultations and how we thought through your process, then you should look at the full consultation document, which is on our website. We've also got some quick guides as well to the risk assessments and codes on our website. And if you would like to help us create more accessible materials, please let us know, and we'll send an email in the follow-up with details about how to do that. And if you just want to go to the next slide, we will hand over to Ali for questions and answers. But in case it hasn't been mentioned yet, the closing date is the 17th of July.